everyone, and welcome to our Monday Minute. Face-to-face encounters are on the forefront of questions in home health yet again. Home health has had face-to-face encounter regulations since 2011. It was updated in 2015, and the regulation itself has not changed since April 1st of 2015, but there have been multiple clarifications, etc., that have occurred over the last 10 years, 2025 being no exception. So a few months ago, we started seeing some issues with denials regarding face-to-face encounters when it was a community referral specifically, and the community physician that conducted the face-to-face encounter was not the certifying physician. There was an uproar, for lack of a better term, across the nation when we started seeing these denials, because that had not been the practice in prior years. So I want to read to you excerpts from a clarification that was issued by Palmetto GBA on May 8th of 2025, including that the certifying physician or physician with privileges caring for a patient in an acute or post-acute care facility in which the patient is directly admitted to home health may conduct and sign the face-to-face encounter. Please understand, it says specifically, and this has always been the case, from an acute or post-acute care facility in which the patient or from which the patient is directly admitted to home health. So if the facility is a hospital and then the patient transitions to a SNF and the SNF sends the patient to home health, you must utilize the face-to-face encounter from the SNF. The certifying nurse practitioner, certifying nurse specialist, clinical nurse specialist, or nurse practitioner, which has been in effect since 2020, I believe, 2021 maybe, when the waivers were issued during the public health emergency, allowed for those additional providers to be able to certify home health patients and conduct those face-to-face encounters. Then the clarification that we're talking about today specifically comes. A community provider can perform the face-to-face encounter even if they are not the certifying provider. Keep listening. Evidence of collaboration must be included in the documentation which verifies that prior to the certification, the certifying provider collaborated with the provider who performed the face-to-face encounter. Now, this is the biggest clarification coming up, which is no evidence of collaboration is required if it can be determined that the certifying provider and the provider who performed the face-to-face are from the same physician practice. So if you have an MD that is certifying your home health patient and a nurse practitioner working under them conducts the face-to-face encounter, or even if another MD within the same physician practice conducts the face-to-face encounter, it will be acceptable. And they have given quotes to the regulation. This again is from Palmetto GBA. We will provide a link to it in our minute today. I just want to be clear that the face-to-face encounter requirements include that you must have that face-to-face within 90 days prior to, within 30 days after the start of care date. The primary diagnosis for the start of care plan of care must be treated during that face-to-face encounter. And then we have just covered what providers might be allowed to provide that encounter. Also keep in mind that telehealth face-to-face encounters are still allowable through September 30th of 2025. Make sure that in a telehealth situation, the physician or non-physician practitioner conducting that face-to-face encounter documents that it was both audio and video, and it must have been performed on a HIPAA-compliant platform. Thank you all for participating today. Healthcare Provider Solutions stands ready to assist with any face-to-face needs that you might have. Also keep in mind that we will discuss medical review as related to the face-to-face encounter in our 2-day workshop coming up in August of 2025 in Nashville, Tennessee, and we hope to see you there. Have a great week.